Hello, and welcome to Vatech America. Today, we come to you from Cypress, California, the site of our brand new state-of-the-art facility and world-class showroom. I'm sure your decision to choose Vatech wasn't an easy one, with so many options on the market. At the end of the day, whatever led you to Vatech, we're grateful that you did choose us as your imaging partner. It could have been from a variety of different reasons: image quality, support, industry-leading warranty, or the education platform that you're going to experience here today. Ultimately, our job as your imaging partner is to ensure that you and your team implement this technology seamlessly. Enjoy the next hour with the Vatech Education team, and thank you again for choosing Vatech America.
Welcome to your Vatech Education experience. At the conclusion of today's sessions, you will understand the available modes for your new Vatech device, be able to accurately position patients, resulting in high-quality images, and also efficiently navigate the Vatech software.
In addition to this training session, Vatech America has created a customized educational experience for you. The Vatech Education Academy has over 250 hours of on-demand content right from our website. We broadcast weekly 20-minute lunch and learn sessions on various clinical topics and ongoing training sessions customized for you.
Before we begin, I would like to point out the chat feature on your screen. This allows you to chat with Vatech team members during your training session.
Before today's live session, we prepared a presentation of our software workflow, including the most common questions and concerns, including CBCT image acquisition and how to identify patient movement, panoramic troubleshooting and image quality, CBCT exporting, and an introduction to our 3D software, EZ3DI.
Thank you for choosing Vatech as your imaging partner. Here we are at our Vatech Education Academy. We are at vatechamerica.com/education. Let's look at some of the content within the Academy portal. Here you will find options to connect with a training specialist, launching our team viewer, or FAQ area for frequently asked questions. The quick reference area provides short training modules answering the most common questions that we receive. Videos and resources. The bulk of our education modules are located here. Viewing left to right, you will find device video modules including imaging for 3D, 2D, and intraoral tutorials, followed by software modules, and finally recorded webinars, which include past lunch and learn sessions and clinical partner sessions with industry key opinion leaders. To access, simply select your area of interest and create your account. Selecting a device or software option navigates you to the training modules. This is a device overview for the Vatech A9. We're going to start with the on-off switch, which is underneath the horizontal column. It's a green toggle switch. You want to toggle this on in the morning. You'll notice that the overhead will go into a start rotation. And in the evening, you want to go ahead and toggle it off to power the machine down. A9 emergency stop switch is also underneath the horizontal arm. It is a red button. To press that red button, it will cut the power to the overhead. Turn the knob and it will restore power to the overhead. Next, let's look at our A9 appliances. The A9 comes with your bite stick. Also comes with the edentulous cup and our TMJ and sinus appliance. The edentulous cup and the bite stick will utilize the large chin rest. Your TMJ and sinus appliance will utilize the shorter chin rest. The Vatech A9 column up and down button are on the horizontal arm. There's also your hand switch for up and down of the device itself. A unique feature of the A9 is there is no canine and there are no temple supports. One function of the A9 to move from pano to CBCT is you will move the entire chin rest back away from the column for CBCT and forward towards the column for pano mode. The A9 also includes a horizontal beam adjustment specifically for our Frankfurt horizontal beam, and a patient positioning mirror where the patient can see themselves in the mirror. Let's talk about cleaning and care. You want to use a hydrogen peroxide based cleaner or wipe. I'm going to go ahead and wipe down any areas with my wipe. We're going to let that set per the manufacturer's recommended time. Come back with a dry, clean cloth and wipe down any excess. Lastly, let's talk about location of the device serial number. It is on the lower right column, starting with 098. You want to be aware that if and when you do talk to either your dealer, Vatech customer support, or if you're working with Vatech Education, we will ask you for that serial number.
To take a CBCT, we're going to start inside of EasyDent Eye with the patient chart open. Be sure to have the correct patient chart up, as when taking a CBCT, it digitally burns the patient name into the DICOM files themselves. From there, we simply click on the Acquisition tab on the top of the screen and click CT from the panel on the left. The screen opens up to the CBCT interface to make our selections. Beginning with the gender options on the lower left of the screen, options include man, woman, and child. Note, if the patient is 12 or under in the system, it will automatically select child as the default. To the right of gender are the patient size and density settings. Options include hard, standard, which is your default, and soft. Now let's move to the right panel under the field of view section. This device is very simple to use. There is one field of view, 8 by 8. So that is 8 centimeters in diameter by 8 centimeters high. Additional image options include high resolution, which is your default, and the green setting for reduced radiation. Also, voxel-based options below this include standard for highest quality and application allowing for a larger voxel size. Also notice the message information area across the bottom left of the screen, always displaying the status and the next steps to take. Once we have our selections made, we can simply click confirm and move on to position our patient. Before positioning the patient, ensure the mode adjustment slider is set to the CBCT mode by gently sliding the lever to the CBCT position. First, have your patient seated, sitting as upright as possible a few feet away from the machine. Adjust the chin height approximately a ½ inch under the chin by using the column up and column down buttons on the hand switch on the side of the device. Alternatively, you can use the buttons on top of the horizontal arm in front of the mirror as well. As you have the patient roll into the machine, have them hold the handrails with their palms facing up. Keep the feet at shoulder width apart for stability. Ideally, we want the patient's spine to be as upright as possible and the chest close to the device during image acquisition. With a clean vinyl bite stick cover, have the patient bite on the bite stick firmly in place. Ensure the teeth are firmly in the grooves. As a tip, pull down on the bite stick to secure the patient. Next, we focus on the mid-sagittal light and focus on getting that line through 2 anatomical points on the patient's head. One in the center of the eyes and the other at the philtrum area, so that the line is right through the center of the head. To adjust the position, move or tilt the patient's head to conform to the line. The A9 has a mirror attached to the vertical frame for both the operator and the patient to ensure they are centered and positioned properly in the device. Once we have established the mid-sagittal line position, we want to ensure the patient's upper arch is as parallel to the floor as possible. Have the patient smile and visually verify that the upper arch is parallel with the floor. If adjustment is needed, use the column up and column down buttons on the hand switch to adjust for the occlusion. Once patient positioning is complete, we can simply hit the ready button on the acquisition computer interface and the machine will rotate to capture position. Have the patient close their lips around the bite stick, tongue at rest, and eyes closed. Have the patient as still as possible during image acquisition, as this will affect your image quality. To acquire an image, hold down the exposure switch, which will turn yellow once exposing, and hold. Do not let go of the switch until the image is complete.
Image capturing is complete. Please wait a moment.
Once image acquisition is fully completed, we can release our patient. The image is then saved directly to the patient's chart within EasyDent Eye for review. Normal chin rest with normal bite stick for both pano and CT mode. Normal chin rest with special bite B or edentulous rest for both pano and CT modes. To take a 2D panoramic image with our patient chart up with an EasyDent Eye, we are simply going to click on the Acquisition tab on the top of the screen and select Panorama on the panel to the left. It will then take us into our A9 interface screen to select our options. First, we begin with patient gender. Options include man, woman, or child. Note, the system will automatically choose child if the patient is 12 or under. To the right of gender, we have exposure-based settings based on the patient's density or size. Options include hard, standard, which is your default, and soft. Moving to the right side panel on the screen, the options here are very simple. Under arch selection, options are narrow, normal, which is your default, and wide. Moving down to the panel examination area, standard is your default, capturing all dentition and condyles. Additional options include right side only, left side only, and front. Also notice the message information area at the bottom left of the screen, always displaying the status and the next steps to take. Once our selections are made, we can simply click confirm. The machine will then rotate to the acquired position and we can position our patient. Before positioning the patient, ensure the mode adjustment slider is set to the panel mode by gently sliding the lever to the panel position. In preparation, have the patient remove all metal objects from the neck up, including necklaces, eyeglasses, earrings, and any other metal objects. First, have your patient seated, sitting as upright as possible a few feet away from the machine. Adjust the chin height approximately a ½ inch under the chin by using the column up and column down buttons on the hand switch on the side of the device. Alternatively, you can use the buttons on top of the horizontal arm in front of the mirror as well. As you have the patient roll into the machine, have them hold the handrails with their palms facing up. Keep the feet at shoulder width apart for stability. Ideally, we want the patient's spine to be as upright as possible and the chest close to the device during image acquisition. With a clean vinyl bite stick cover, have the patient bite in the bite stick firmly in place. Ensure the teeth are firmly in the grooves. As a tip, pull down on the bite stick to secure the patient. The goal is to have the spine as vertical as possible when biting on the bite stick to avoid spinal shadowing. Next, we focus on the mid-sagittal light and focus on getting that line through 2 anatomical points on the patient's head. One in the center of the eyes and the other at the philtrum area so that the line is right through the center of the head. To adjust the position, move or tilt the patient's head to conform to the line. The A9 has a mirror attached to the vertical frame for both the operator and the patient to ensure they are centered and positioned properly in the device. Moving on to the Frankfurt plane line. This line is designed to run through 2 anatomical points in the patient's face, through the tragus and the bottom of the orbit of the eye. If the line is out of position on either point, slide the adjustment slider on the back of the arm up or down to adjust. It may be necessary to angle the head to conform to the laser line as necessary. The objective of this beam is to have the head tilted to a natural head position and the occlusion at a 10-degree angle when positioned in the machine, which is what produces the slight smile effect in the pan. As a tip, it is a good idea to have the patient smile and view the 10-degree angle of the posterior teeth. Once patient positioning is complete, we can simply hit the ready button on the acquisition computer interface and the machine will rotate to capture position. Have the patient close their lips around the bite stick, swallow, and have their tongue flat against the roof of their mouth and eyes closed. To acquire an image, hold down the exposure switch, which will turn yellow once exposing, and hold. Do not let go of the switch until the image is complete.
Image capturing is complete. Please wait a moment.
Once image acquisition is fully completed, we can release our patient. The image is then saved directly to the patient's chart within EasyDent Eye for review. Follow these simple steps to acquire an extraoral bite wing X-ray with your A9 device. The protocol to take a bite wing image is going to be the same as the pan except for the following. On the acquisition screen, select the following from the right side panel, orthogonal, and under the panel examination area, select bite wing. Also available are bite wing right, bite wing left, and bite wing incisor. Click confirm and continue with the standard panorama protocol. Normal chin rest with normal bite stick for both pano and CT mode. Normal chin rest with special bite B or edentulous rest for both pano and CT modes. Special shorter chin rest with special bite A for 2D TMJ.
So Paul, we just went through, patient positioning on the cone beam here, and I think it's important to do a little bit of talking about CT image quality and evaluation. Would you agree?
Yeah, absolutely. Taking a look at your images immediately after you take them is a great idea to verify you captured the proper anatomy and making sure everything looks the way it should.
For sure. And I think that also does then the patient's still there, and then do I need to retake the image because I've just evaluated? So that's going to be save a lot of headache for the office and the patient. So Paul, what really causes distortion whenever we get poor quality images?
Well, the distortion, the number one issue that we come across training clients is definitely patient movement, I would say, is a big factor, making sure that the patient is secured in the machine, you have the temple rod secured, clicking that acquisition button, ensuring that they're not moving, because when the patient, if they move even the slightest bit, you can see some ghosting and distortion in that image, for sure.
Yeah, we just talked about that of, ensuring the patient's stable and all those things. So let's look at, I'm going to bring up one image here, and I'm going to bring up this virtual rendering we can see, and look how clear it is. I mean, I'm seeing clear definition on the root tips all the way through the mandible in this image here. Now, what happens when we see patient movement? What are you seeing here, Paul, on this image?
A lot of blurriness. You can see there's not much definition around, in the gum area, and it's overall blurry because of the patient movement.
Right. Yeah. Let's look at a comparison here. Here's a side by side. I mean, there's no comparison there. But yeah, the blurriness on the left is definitely from patient movement.
Right.
Paul, I'm going to open up a data set here that is a really clean image, and actually it's the data set from the image on the right hand side. So I've got it open right here, and we can see as we go through this, let's even look at our axial cut here, and I'm going to scroll superior inferior. You can see nice clean definition on this data set here. There's really no distortion.
Right.
Clean lines there. So let's go back into our EasyDent Eye here, and I'm going to go ahead and launch another data set here. So I've opened up the data set, and this one you can see a lot of distortion. And Paul, I'll let you kind of run through, and we can start with the virtual rendering, maybe move the axial and then the coronal, and kind of describe what we're seeing here.
In this case, it's a situation where the patient, as the scan was being taken, because we can see that one side is fairly clear, they moved during the scan, so causing that entire right side there to be completely distorted. And you can see it especially in the coronal view, where they probably moved their whole head, moving that jaw left and right there, creating that kind of a ghosted image. You kind of see the jaw there about 3 times in there, creating that overlapping ghosting image there.
Yeah, I agree. So I'm following the ramus down here, and then as you described, here's another ghosting, so you can see a lot of ghosting through here, whereas we look on the patient's left side, look how clear it is here, which is also translated in the mandible, patient's right side versus the left side here. Yep, on there. So that's a very good example of looking and recognizing patient movement within a scan. I'm going to go ahead and jump back to EasyDent Eye software here. Did you want to add something here?
I was just going to say the reason is a lot of these times because we see essentially where the ramus is, you see 3 separate images almost. That's probably because they just quickly move their jaw because the machine's going around. So if they do a faster movement of their jaw, you'll see more ghosted images like that.
Exactly. I agree. Yep. Let's go ahead and open up EasyDent Eye. And I did want to highlight a couple of other images here. And here's another image where we've got patients with patient movement here. You can see on the anterior, you've got the ghosting images, a ghosting of the incisal edge, and several layers of distortion there. And in another comparison here, we've got left side, you see that streaking effect, and on the right side, really clear, nice definition on the data that we're seeing there. Also wanted to touch on something else you may see in the cone beams, and this shouldn't be there. So if you do see any circles within the data, you can see here we have got one circle, two circles within the axial cut, and some long, dark vertical lines on the other. This is where the device needs to have like a beam alignment or some internal adjustments on there. So if by chance you do see that, that is something else that we would need to have our service team log in and adjust. So Paul, we just finished up looking at patient movement. Now let's look at a little bit of distortion that you see or artifact you see in scans that's highlighted as scatter in the images. So what I'm going to do is I'm going to go ahead and enlarge our 3D rendering here. And we can see off of any dense areas, you can see a little bit of scatter or streaking effect in the image. And there are, our compressed sensing technology to reduce that, but you're going to get a little bit of scatter in the data sets, and that is nature of cone beam right now. And you can see what that looks like off the crowns here. Some dense objects is this streaking effect right through here. Let's go ahead and look at our axial cut to look at how the software handles that metal. So you can see our two implants here. And I'm going to scroll through and let's enlarge this and bring this to the center here. So you can see we have a very little scatter off of there, some streaking effect, but the software handles that very well through that compressed sensing technology through there. And we can scroll back down and let's look on our axial cut here off the gutta percha and our crowns. You see a very little streaking effect through there, but that is some of that beam hardening within the data set itself.
And that scatter, Jim, is basically the beam bouncing off of the restoration or the implant, creating that streaking.
That is correct. Yeah, it cannot pass through. Yeah, so it is a reflection off of there. And like we talked about, Vatech does have its third generation compressed sensing technology to reduce that down, but you will see a little bit of that scatter within your data sets. That's why it's very important to make sure, like we talked about when we were doing our patient positioning, to ensure that that patient is positioned and their occlusion is flat or parallel with the floor, because the scatter only streaks horizontal through there. And I think that about sums up what we wanted to talk about. We touched on looking at scatter. We talked about evaluating patient movement. And then we also talked about if we see any distortion in the images with that, redoing that beam alignment on the device. So I think that kind of concludes what we wanted to review on CBCT image evaluation.
So Jim, why don't we talk about some fundamentals of hand positioning and common things that can occur in your images?
That sounds great, Paul. I mean, we just finished our patient positioning portion, and now let's look at images. And on screen here, I would consider this a high quality image. I've got my clear anteriors, a nice smile there. My condyles are straight up and down. So the question is, what do we look for in Pan IQ?
Right. Several things.
And why don't you describe on here, take me through what we're seeing here and what those 6 or 7 evaluation techniques we use to look at a pan.
Yeah, so the dashed white lines kind of outline just what we're looking at. We don't want the occlusion flat. We want a slight smile by having that 10-degree angle of the posterior teeth in there, which creates that slight smile you see there. You have the palate is nice and flat up there. It's designated by those white double-digit lines there. The condyles are even. One side's not tilted or larger than the other. And the chin there is in a slant position.
Right. So that's what we look for when we're evaluating. The thing is, we're working with patients and they may not be compliant to what we've asked them to do. And one thing that happens all the time, and you all know that, is where they bite on the bite stick too far forward. They bite in front of the groove, and maybe we don't have our canine light properly aligned. And Paul, what do we see here that usually happens when we're out of that focal trough?
Well, we see blurry anteriors, and even in this one, the spine position is out of position. You want to have that spine as upright as possible, even before they bite on the bite stick. Visualize where that spine is. You want it very upright. Have them bite in the bite grooves. Make sure they're biting in the bite grooves to avoid this issue.
Right. Now, there's also another extreme if they're biting too far back off of the bite stick, or maybe the canine light is not lined up. We have that too far mesial. This is where we get that blurry anterior there, you can see. And so we're out of that focal trough.
Right.
And it's causing that blurry anterior.
So in this next image, we can see that the patient's head is basically tilted too far down. They're angled too forward and too far down. So you can see the curvature there, the occlusal plane is off. So the solution would be to get them in an ideal resting position and get that Frankfurt plane aligned properly. So we have that Frankfurt plane from the tragus to the bottom of the orbit. Just basically a natural head position would avoid this issue. So I would, be grabbing their head and just positioning it back a little bit further.
And maybe having the maxillary occlusion tip down right about 10 degrees so we don't get that sharp V in this pan here.
Right. Right.
Yeah. And on the opposite spectrum, where their head's tipped up too high, that causes that frown. And you can see those condyles are tipped out. So that's what we're going to see when we have the patients with their head tipped up too high. It's going to cause the pan with a frown. So do not want this image here. Paul, let you talk about this one here where maybe the head's tilted one way or the other.
Yeah. So we can see on that image on the right there, the head, they're just tilted way too much to the right. So aligning your mid-sagittal beam through the center of the head will avoid this issue.
Yeah, and then the result, if they are positioned like this, is you get magnification on one side, the right side versus the left side on your panoramic itself. Now, the other factor that could happen is where their head's twisted. So that line could look like it's right through the center of the patient, the mid-sagittal beam, but they could be twisted. And if that happens, you get elongation where the ramus gets stretched out or your molars get stretched out, and you can see that is highlighted here with the double arrows on right side versus left side.
Right.
This next slide, Paul, I think we all come across this where we ask the patient to put the tongue flat to the roof of the mouth and they don't, or how are we telling them? So here we can see where we have the dark shadow going through the maxillary arch. That is actually the air that's behind the front teeth. And several offices, when we instruct them on how to position, how to relate this to the patient, I have them swallow and then keep the tongue flat to the roof of the mouth. And that should eliminate that shadow that is interfering with those maxillary teeth there. Often we see lower anterior distortion, and that's where we have the patient they're not standing up straight. We want that spine straight and their chest right up against the chin rest there. And we talked about that when we did our patient positioning a little while ago. So it's really important to make sure that their body is right up against that, spine is vertical, and that's gonna eliminate having that washed out anterior region there. Paul, what happens whenever the patient moves? If we don't have those temple supports tight, what happens then?
The entire image usually is going to be blurry and not well defined.
Yeah, so that's really important to get those temple supports nice and tight, and that's going to eliminate any or reduce the chance for any patient movement there. If we are using a lead apron and we see any radiopaque triangles at the inferior border of the pan, that's going to be where the lead apron was improperly positioned. So I always say you want to have the lead apron high in the front and low in the back. Since when we're imaging our anteriors, we want to make sure that that lead apron is properly positioned on the patient, and that's going to remove any artifact that we have at the inferior border of the pan itself.
Right. And
take us through a brief overview of, like image that's too light or too dark, underexposed, overexposed. What happens there? What has happened if we see that?
So when you see an image like that, a lot of times if it's too light, we're underexposing it. And if it's too dark, we're overexposing it.
The Vatech software, as we just reviewed, it auto sets the KV and the MA and the time based on the patient, the age of the patient, and the morphology. Sometimes if we forget to set that, or if we forget to add patient information or change man, woman, and child, this is when this could cause underexposure or overexposure. So always make sure that we have it on the proper patient's body type and bone density, and we should not have this issue here.
So Jim, in this next image, we can see the patient clearly has earrings on, and that will not only show up in your image, it'll cause streaking. That's what we can see in the upper two white boxes on top there. As it goes around, it causes streaking then on the opposite sides.
Yeah, so ensure taking off jewelry, glasses, necklaces, right?
We recommend, having the patient take off anything metal from the neck up as much as possible.
I agree. That's going to give us that clean image without that distortion and streaking effect there.
Right.
So here's a really nice image. I would say this patient's been positioned properly, but Paul, what are you seeing in the image?
Well, I would say the head's tilted slightly, but we see the earrings in the image. And then again, also the streaking above that look like little rectangles are from the earrings.
Yeah, so I think that's the thing of, we get our earrings in here and the sinuses, we get that streaking effect and the distortion above those earrings. Otherwise, beautiful pan. Let's look at one more before we conclude. What are you seeing here on this image?
See that little white area on the bottom portion of the image, which is going to be the vest essentially creeping up on the back of the neck, causing that little white spot there.
So Paul, I think that concludes our review of the panoramic imaging troubleshooting or image IQ. I think the main things are ensuring that we are positioning the patient proper, taking off the jewelry, which should result in a clinically diagnostic image. Now that we have captured our CBCT data, let's go ahead and look at some of the basics in the EZ3DI software. First, I'm going to double click on the CT icon, and this will launch our EZ3DI software. First thing I would like to do is look at our main menu and settings. Things to change: teeth code, make sure this is set on universal. We want to come over here to View, 3D Viewer, change plane type from outline to plane. Next, we will navigate to 2D Viewer, change our panorama view default thickness to either 10 or 20 millimeters. Lastly, we will click on Navigator, go to Volume Panoramic Navigator, default interval, we want to change it to 1 millimeter. From there, we will select OK. An overview of the EZ3DI software. You'll notice at the top tabs, MPR, section, all the way through consult. These are various different tabs and clinical functionality. For this training, we will start in the MPR, and we will also work in 3D Pan. Your MPR window consists of 4 sub-windows. Your coronal, and you'll notice it's highlighted in yellow here. Your axial, which is highlighted in blue. And your sagittal, which is highlighted in reddish orange. Note in the corresponding windows, the color slices here. So I have my red reference line. If I grab this, left click and drag, I'm dragging lateral and medial and moving the sagittal window. The blue axial line, if I drag this up superior and down inferior, also changes in the 3 windows. Lastly, my coronal yellow line, I can move this anterior and posterior. Another way to move this line is to use the wheel on your mouse. Simply roll the wheel and you will see the image scrolling up or down, in this case, in your axial window. Another thing to note, everything is highlighted. Your axial has right here, left, sagittal shows anterior and posterior. The lower right window in this case is your 3D virtual rendering. I can left click and drag and move this around. We also have our quick icons at the bottom, which we can click through. To enlarge one of these windows, I can either hit Enter on my keyboard or I can double click on the corner of the window. In this case, I will double click on the corner of the axial window. I'm also going to hit the space bar on my keyboard, which will toggle these crosshairs on and off. Space bar toggles on. Enter will minimize that window again. Top toolbar includes features of panning, which allows you to move the image around. Left click and move this around. Magnifying in or out, left click and drag. Your measurement tool length, click, and left click will give you your length, and I can drag that out of the way. To delete, right click and delete. The next icon is your nerve trace. We will look at this in future trainings. Your camera capture, which takes a screenshot of the entire window. And one of the more important icons here is your reset view. This will reset the view to the original position. Your next icon is export. This allows you to export the CBCT data with your project, allowing the user that you're sending this to be able to open your data in a Vatech viewer. Just to the right, we have our drop down, including measurement, capture, annotation, all the way through, etc. Next, let's look at an overall view of your Vatech data. I want to grab the axial slice, move this to the superior border of the scan. I'm going to come down to my axial window, spacebar. I'm going to use the wheel on my mouse to scroll through my image. I can see on my alternate windows, my blue axial slice tells me where I'm at within the patient's anatomy. Here, maxillary sinuses, wing of the cephenoid, nasal concha, our septum. As I scroll down inferior, start to see our palate. We can look at our individual root tips, the incisive canal. Keep scrolling down. Lingula here and here. We can also see on this 3D rendering where we're at with the blue slice. Let's keep scrolling down inferior, going through our molars. You can see RTC there. And as we scroll down inferior, mental foramen on the right, epiglottis here, and now we are to the inferior border of the scan. That is my first step in reviewing my image. Next, I'm going to move my coronal slice to the front of the scan, select the spacebar, use the wheel on the mouse, and let's scroll anterior, posterior, going through 8 and 9. Gives a good visualization of our maxillary sinuses, that sinus floor, width of our ridge, height of our ridge. And I'm following with my eye, going all the way posterior back through the entire scan. Hyoid bone here. And now we are back into our spine and at the posterior border of the scan. I'm now going to select the spacebar and reset my scan. That is our MPR window, brief overview. I'm going to go into my 3D pan. The 3D pan essentially takes your 3D rendering and flattens it out into a navigatable image. Here are your quick buttons. Center of the screen, we have our navigation window. I can left click and drag in a negative space to move this around, exploring the image. I can also double click on an area to navigate quickly to a certain area. In this case, I'm going to go over to my virtual rendering or VR coloring and select MIP or maximum intensity projection. Here you will see the grayscale of the image. Next, I will double click on tooth number 19. I'm going to come here to these blue circles and left click and rotate. As I do that, you will notice my red lines are vertical following the long axis of tooth number 19. Below this, I have my section. You can see your buccal and your lingual. These 3 vertical red lines correspond to my 3 sections at the bottom of the image. I will now double click on the single center image for one image. If I use the wheel on the mouse, I am scrolling back distal and then mesial. I can also drag this blue line to the crest of the ridge. I'm going to come up and take a measurement across the ridge and down to our nerve. Left click to drag these 2 measurements out of the way. Now I'm going to go ahead and place my implant. Go over to the left, insert implant. For this demonstration, we will look at single implant, number 19. I can select my company here. In this case, I have Neodent. We are on the GM Helix implant lineup. I'm going to come down to scroll through, find my implant. Select Insert, and I get this pop-up window that tells me to place the implant. It's telling me to place number 19. Come down to my sectional slice, and I'm going to click wherever I want the crest or the platform of the implant. I can click on my implant and rotate as needed, and we can see our implant placed on this window. I do have my bone density window here. I can rotate around. I see this green arrow, which corresponds to my scout. We are looking buccal in lingual. Grayscale or density range on the left, and it is also color-coded on the implant. From here, I may come in and take a screenshot. I'm going to navigate back to the MPR window and change our virtual rendering. We can see our virtual rendering here. Lastly, I want to look at exporting our data. If I come up to the icon here, export, click on this, change this to local disk. I'm going to add the viewer. I'm going to click on save. This will allow us to export this to your desktop or a designated location, which includes the viewer and the DICOM. This was meant to be a brief tutorial to get you started navigating the software. You can find additional training modules in the Vatech Education Academy, which will guide you through your process of learning this software. This concludes our training session for today. If you do have any questions, feel free to email us. You can also sign up for additional training at our Vatech Education Academy on the online scheduler. Thank you for choosing Vatech as your valued imaging partner.